We keep mentioning the problem list, and this is why. We've been told by our providers that there's just not great tools out there with the leading EHRs, and these are anonymized EHRs. We're concealing their names right here, but a whole lot of problems here in terms of the dirty list, incomplete list, duplicative problems, missing HCCs or DRGs, and then unaddressed HCCs. This is why the data is soft and inadequate and inaccurate, is because these problem lists aren't setting providers up to do their best work with these workflows. We've talked to providers beyond just getting their input here, and they've told us exactly how they want to address this issue and how they could best execute on problem lists going forward to provide better care decisions for their patients. Increased document specificity is something that is a key component of unoptimized data, inadequately documented data that impacts the workflows for your risk adjustment programs. This includes secondary code capture. If you just have an unspecified diagnoses, then obviously you're not going to have secondary code capture because of that. Wes is going to show how our system automatically brings those issues to the front for providers to look at and to evaluate, and then for them to easily act on if they choose to do so. And that reduces the documentation burden. They don't have to go back and look for things that they may not have documented. We bring that to the front for them to consider. This increased risk scores reduces their queries back in there, just makes them more efficient generally, and optimizes reimbursement opportunity as well. We looked at some data from our base of installation, and we found that there's a 3 times organic growth of IMO's problem list view. This just shows the ability that we have to appeal to providers and for them to adopt because of that. 163% increase in problem list cleanup activities. It's what you'd expect when you have dirty lists. They need to be cleaned up. 37% decrease in new duplicate problems. Only 5% of diagnoses are unspecified. A 10% increase in Medicare Advantage scores is what we've seen typically, which is incredibly strong. Other vendors do not offer that at the point of care, and they can't offer that really because they don't have the code mapping foundation layer that we have through our deep technology stack that we have in EHRs currently. We remind providers the need to recapture diagnoses from prior years. We get that 30% lost recapture rate down significantly, which in and of itself is going to help with risk adjustment scores. We'll query the patient's clinical notes and provide suggestions and messages, but we also provide payer messages, suggestions, gap in care from multiple different payers. We want this to be the standard of care that providers look for and are able to incorporate into their decision making for their patient.